Welcome, everybody, to our special 2023 festive edition of the Animal Heartbeat. I am Kieran Borgea, and I'm here with my co-host and brother in cardiology podcasting, Novo Matos. Hi, Jose.
Hi, Kieran. It's so good to be back.
It's great to be back. Yeah, it's great to be back. And it's so close to Christmas. How exciting. Are your family excited for Christmas now?
Yes, very, very much. The kids are over the moon. We are in Portugal now and ready for Christmas.
Ready to go. Excellent. Now, I remember visiting a Dutch friend about this time last year to help him do a transpulmonic stent. And he was telling me about the Dutch Father Christmas and how they come quite early in December, and he comes on a boat from Portugal. Do you know the link there between the Dutch Father Christmas and the Portuguese kind of beginnings of that?
No, I had no clue.
That is a thing, yeah.
Yeah.
So best
you
of
learn,
luck to him.
You learn so much with this podcast, isn't it?
We learn a little bit about cardiology and a lot about life.
Exactly.
So why are we here today, Jose?
So today we have a very special episode for you guys, the 12 heart diseases of Christmas.
On the first day of Christmas, my true love sent to me.
I'm excited.
Kieran and I will tell you about our favorite 12 heart diseases. So these will be brief summaries of top facts of each of these conditions, which we pick because we like them.
I think if anyone out there doesn't have a favorite heart disease of Christmas, they will after today.
Exactly. You can pick one of these 12.
You can pick one of these 12, or you can generate your own, email us and let us know what you think. So I actually asked the question on Instagram yesterday, what are people's favorite heart diseases of 2023? Do you want to know what people said?
Yeah, absolutely.
And we'll see if some of these come up in our episode. So, hang on. I can't seem to find it. The first response was actually, what a question. I do ortho. I can't even interpret an ECG. Which I was a little disappointed by. So we have hypertrophic cardiomyopathy. They're a regular listener.
Winner.
They must be. Thanks for posting, Jose, on there. Cardiac tamponade, which is a fun one. I like a bit of cardiac tamponade. It's not made my few choices for the list. There's a tough one here. Rupture of an anterior papillary muscle.
Ooh.
That's a rough one.
Wow.
And somebody else has said melody valve placement. I mean, they're just showing off, right? If they're placing melody valves. Maybe that's Busadori. Left pulmonary artery stenosis in a cat. It's pretty, a pretty good one. Did you have a PA stenosis in a cat recently? Is that right?
Yeah, exactly. We have a cat with a bilateral branch pulmonary stenosis, and
right.
Yeah, they're interesting cases, isn't it? But it's so difficult to decide when to intervene, but yeah, interesting cases. Yeah.
Interventions in cats are tough, aren't they? And then we have a nice one here, a reverse PDA, a right to left PDA.
That'd be a good one, yeah.
Yeah, it's a good one. And some of those themes are coming up actually in our list. So should we dive right into it? I think our plan for the listeners is to share our top 12 heart diseases and choosing 6 of them each. Now, I reckon we could have a public vote, or maybe we can just discuss ourselves and choose which one the coolest is. I reckon I can persuade you that one of my choices is the best.
Not so sure about that because I already made my mind. But
oh, have you? Definitely HCM. Okay, so let's think about it. Do you want to go first? What's first on your list?
On the 12th day of Christmas, my true love sent to me.
Yeah, I think I would start. So I'll need to start with cardiomyopathies, but I think I would start with dilated cardiomyopathy phenocopies. So DCM mimickers. I think that's pretty cool. Cardiomyopathy mimickers, either HCM or DCM, are really interesting diseases.
Yeah.
I think with DCM phenocopies, I think it's important to remind our listeners of which diseases out there have been described as mimickers of DCM. So tachycardia-induced cardiomyopathy. Fast heart rates, tachyarrhythmias can cause systolic dysfunction. And that's pretty cool because they can cause a reversible type of dilated cardiomyopathies.
It's one of our favorite things, isn't it? Well, the ones we can really, really help.
Yeah. But then the struggle is always when you see a DCM phenotype and the tachyarrhythmia ends up being a chicken and egg situation. What started first? Of course, if we have maybe the classic example, a young Labrador with a DCM phenotype and bouts of an SVT, this would suggest that most likely this dog has a tachycardia-induced cardiomyopathy and potentially an atrioventricular reciprocating tachycardia. What I think is cool, what I like about tachycardia-induced cardiomyopathy is the idea in humans that just arrhythmias can induce cardiomyopathies, and so now they
the
call
irregularity and the abnormal depolarization sequence is interesting, isn't it?
Which is pretty cool, isn't it? Because just there's a large arrhythmia VPC burden in humans, and I believe something above 10% of the heartbeats in 24 hours can be associated with systolic dysfunction. Of course, this has not been described in dogs, but it's really interesting and food for thought that some of our cases, either with primary DCM that have a lot of arrhythmias, the arrhythmias may be causing worse systolic function, or maybe some cases out there of primary ventricular arrhythmias that are causing DCM phenotypes. So I think that was my first DCM phenocopy. Then myocarditis. We always talk about myocarditis. Unfortunately, we don't know a lot about myocarditis in dogs and cats. All these phenocopies are more relevant when we see an atypical breed with a DCM phenotype. It's not like that you need to go through every single differential diagnosis when you see a Dobie with a DCM phenotype. But especially if you see an atypical breed, mixed breed dog, or a pure breed that rarely has DCM, small breed dog. So those are the cases that we really need to fish for other causes of a DCM phenotype because they are unlikely to have familial or genetic DCM.
I have two thoughts. One of which is when I see an atypical breed, so not a Doberman, not a Boxer, not a Wolfhound, a Newfie, let's say I see a Hungarian Vizsla. I saw one last week, 4-year-old Hungarian Vizsla. I go looking for myocarditis, arrhythmias. I go looking for a primary cause, and often I don't find them, and I'm a bit sad because I want it to be a phenocopy. I don't want it to be primary myocardial disease, and that's something that I sort of I don't know if you identify with. The second thing, you say we shouldn't go looking in the Dobies and the Boxers so much because just statistically the likelihood is higher of them having primary myocardial disease. But don't you sometimes feel like maybe we're missing some Dobies and Boxies who do have tachycardia-induced changes or who do have a myocarditis change, and maybe they're ones that we could help? I sometimes worry about that I should do more in those cases.
Yeah. No, I agree. There's also, of course, a balance of how much stuff you can do time-wise and money-wise and so on. But no, I agree. And talking about that, for example, hypothyroidism, which is a potentially important phenocopy, or at least low levels of thyroxine will affect systolic function. Hypothyroidism is highly prevalent in Dobies. And so it's totally worth it to exclude hyperthyroidism because may not be the primary cause of DCM, but might be contributing.
It's probably not helping, right?
Yeah, exactly. So no, I agree. And now Addison is an interesting one, really, that there have been a few case reports now, or a case report with a few cases of Addison-induced DCM phenotypes or systolic dysfunction. We had a case in the past 6 months, I think. So it's also interesting and important for people to realize that Addison may potentially cause left ventricular systolic dysfunction and DCM phenotype. And it's interesting because the case we have seen with Addison were cases that presented after the medics have treated them. So generally, they present with classic symptoms, signs of Addison, and then they start treating them. They fluid resuscitate them, and so on, and then they present with congestive heart failure.
Wow.
So I guess there was preclinical, or there was systolic dysfunction, and then they were pushed over the edge with IV fluids and mineralocorticoids and so on. which is interesting.
That's really interesting. And, not really on my radar. I mean, Addison's, yeah, sure. I know it can cause cardiac changes, but not that it's after treatment. And that's really interesting. Maybe it's the fluid challenge. I think one of the difficulties with these is, even if it's a phenocopy, let's say tachycardia-induced cardiomyopathy, for the sake of argument, and it's been long-standing and they present with heart failure signs, and we do our best to treat them, and we only get a partial response because there's so much fibrosis and remodeling in the heart that it's past the point of no return. And for those guys, I guess the outcome's the same, maybe, as if it was a primary cardiomyopathy. But, it's really hard to know at the time of diagnosis, isn't it? We don't know what the cause is. We have to go on a safari and do more tests.
Yeah, exactly. We also need to mention diet, though it's potentially a bit controversial, how the impact of grain-free diets on cardiac function in general, because as we discussed in one of our previous episodes, it's very difficult in the UK, at least, to go to the supermarket and buy a grain-inclusive diet, because probably 90% of diets are grain-free. So I guess not every dog will develop the DCM phenotype or systolic dysfunction on grain-free diets. But it's really important indeed to understand if dogs are on non-traditional diets, especially legume-rich nowadays, grain-free diets, and try to swap them to traditional diets, because that might certainly help. And then we have seen like three golden retrievers in the past 9 months with taurine deficiency. So certain breeds are also prone to taurine deficiency. Yeah, interesting.
I'm a taurine skeptic in dogs. I mean, sure, we know in cats taurine deficiency is important, but I'm a bit of a taurine skeptic in dogs. But then I keep talking to people that are really smart people and I really respect, and they say, "Oh yeah, well, I think we all know there's taurine issues here," and I think, "Oh, okay, maybe I'm missing these cases." So now I'm becoming a little bit more attentive to that, especially for retrievers, especially dogs on lamb-based diets. It seems more common on those lamb-based diets. And you're right about non-traditional foods. That's, I would always evaluate, although not necessarily expect it to be low, even if it is a grain-free issue.
And I think, and to finalize the DCM phenocopies, I think we should mention congenital heart diseases. So when we first diagnosed DCM on echo, is very important for everyone to remember to look for PDAs, to look for VSDs. I think PDA would be my number one. Large breed dogs that the continuous murmur might have been missed, and they sometimes on echo they look like DCM. So important not to forget to exclude a left to right shunt.
Yeah, I'll never forget a 6-year-old Newfie diagnosed with DCM that I saw for a re-exam, and it had a PDA on the echo. So they're not as easy as we think sometimes, are they?
Yeah, I totally agree. So a thorough echo is important, not just look at the left ventricle and say, "Yeah, this is DCM," and start PEMO. Very good. So I think that's my first heart disease.
Yeah, it's an interesting start. I mean, I think it's important. But you mentioned cardiomyopathy, you mentioned phenocopies. I'm going to talk about a cat with hypertrophy. Feel like I'm treading on your territory here.
On the 11th day of Christmas, my true love sent to me.
So I'm going to talk about acromegalic cardiomyopathy in cats.
Nice.
This is something that I'm super interested in. At one point, considered going down a PhD route, trying to find a PhD there. I'm super interested in this as a concept, that it's a reversible hypertrophic phenotype of cardiomyopathy in cats, caused by hypersomatotropism. So hypersomatotropism in cats, many people will know it's acromegaly, because that's what we'd call it when a cat develops hypersomatotropism in adulthood. It's normally secondary to a pituitary adenoma, which is producing an excess of growth hormone, and that triggers an increase in IGF-1. So we make a diagnosis of it by measuring IGF-1, and if IGF-1 is over 1,000, we'd say it's likely acromegalic. When people think of acromegaly, they think, number one, it's rare. Number two, we've got secondary changes to the face, the paws. And number three, it causes diabetes, so uncontrolled diabetes. And those things are interesting, because if we look at humans with acromegaly, actually between 30 and 50% of them are diabetic. There's a whole heap of humans out there who are non-diabetic acromegalics. And a few years ago, I was involved in some research on this and reporting some echo changes in cats who had undergone medical treatment with pasireotide and surgical treatment by hypophosectomy to try and control their IGF-1 effects on their body. One of the cats in that cohort was non-diabetic. I thought, oh, that's really interesting. And it was actually the brother of one who'd been diagnosed because of poorly controlled diabetes. And now you see the literature, and they're out there, case series 8 non-diabetic acromegalic cats, 2 non-diabetic acromegalic cats. So there's, probably the ones we're seeing with diabetes are the tip of the iceberg. So I worry, therefore, about how many cats have got secondary changes to the heart that we just don't know about, or how many cats that we diagnose with HCM who are non-hyperthyroid, non-hypertensive, actually have a thing that's reversible. Is that something you think of in your practice when you see cats with HCM? Do you test for acromegaly?
I have to say that I love this subject as well, and the papers you published on these are very, very cool. And I would really strongly recommend everyone to read the paper when you describe the acromegalic cardiomyopathy. Time with cats is never wasted, or something
Time
like
with
that.
cats is never wasted. I'd like to take credit for the
sexy
title.
Sexy title.
Credit or blame, I'm not sure which, but that was definitely Stein Nielsen, my co-author and eminent endocrinologist.
Yeah, that's a really nice manuscript, so everyone should read it. And no, yeah, absolutely, I agree, and I think it's very exciting. I love phenocopies. I love the idea that some stuff out there that we say there's some cases that we call HCM are not HCM, are not familial HCM,
right.
And considering what Stein showed, that acromegaly is so prevalent, or is more prevalent than we believed. Maybe indeed there are cases out there that look like HCM and are acromegaly. But just to answer your question, what my struggle then is, I would honestly love to measure IGF-1 in every single cat. But it's so expensive.
It's money, right? I agree with you. Yeah.
And we can't do it. So I struggle at the moment. Honestly, we are only measuring it in diabetic cats. But it's a shame because we are very likely missing some cases. But what do you do? Because IGF-1, I think, is like £1,000 or something like that. Is expensive just to measure.
It's not that expensive, but it is expensive. It's double the cost of NT-proBNP and troponin, for example. And it's the sort of thing that I think I do think in cats with HCM who are non-diabetic, or sorry, an HCM phenotype who are non-diabetic, I think it's a low yield test. But some data that we published a few years back now suggested that a small proportion of cats, 5%, 7%, something like that, who have a diagnosis of HCM made might actually be acromegalic based on their IGF. Now, obviously, in that paper, we didn't CT their head. We didn't look for an adenoma. We didn't confirm acromegaly. So I'm not saying that all of the positives, in inverted commas, in that paper were acromegalic, but it's just an interesting thought, isn't it? That maybe we are missing it. What do? I definitely test it if they are diabetic. I think if they are an older cat and they have very symmetric hypertrophy, and also especially if they have aortic insufficiency, because that was something that was more prominent in the acromegalic cats in our paper than a group of age-matched controls, I think about acromegalic cardiomyopathy. I don't test them all. I agree. It's money and how likely the test is to yield a positive result. Because if you do get a positive result, then what do? Well, we CT the head if the owners are thinking about surgery. And of course, then there's a whole, the cat's going to be anesthetized with cardiomyopathy, maybe, and you might open a door to something the owners don't want to know, actually. If they're not going to go down the road of brain surgery, basically, then it's kind of pointless knowing if they're acromegalic or not. But it's an interesting topic. What's super interesting for me about it, and where I think would be really interesting to do some research, would be to look at what's happening in the myocardium before surgical treatment, so hypophosectomy, removing the pituitary gland, and therefore the tumor, and normalizing their growth hormone and IGF-1. These cats have reversible changes. So it'd be really nice to know what's being activated in the myocardium to cause that hypertrophy before treatment, and what it looks like after treatment. Now, I hear you say, who wants to biopsy the myocardium in a cat? But it is possible. And maybe there's a picture there on proteomics that could be looked at to look at what pathways are activated, or metabolomics to look at what's happening there in those cases. Because on histopath and on echo, they were not distinguishable from HCM, I don't think. So there's, maybe there's something there we could understand about potential targets for anti-hypertrophic drugs or biomarkers that might help us with prognosis. So there's a whole wealth of research there, I think, that at the moment is as yet untapped.
Yeah. No, I agree. It would be so nice also for different situations to have myocardial biopsies in cats. But having said that, even if you would get a small biopsy forceps, which the ones available nowadays are huge for cats, even if you get a small one, then the sample will be small. So the pathologist will struggle to get a diagnosis, and then the disease may be scattered across the myocardium. The change may not be present in every single myocardial segment. And then most biopsies are taken from the intraventricular septum with the right side approach. There's a lot of challenges, which is a shame because it would be so nice to have a myocardial sample, an easy way to get myocardial samples in cats.
And there are other heart diseases in our list today where biopsy and sampling would really help us to understand what's going on. But it's a big limitation, isn't it, of what we're doing.
Yeah, acromegaly was a great one. Yeah.
So that's the sweethearts. Over to you. What do you think about another one of your top 12 heart diseases of Christmas?
On the 10th day of Christmas, my true love sent to me.
I just thought to share with you an outlier, a case I had.
We love an outlier.
A case that I had in Zurich, which never found the time to publish because it's very cool case, incredibly rare. But I thought I would just bring this one. So this was a cat presented with weakness, a middle-aged non-pedigree cat presented with weakness that we diagnosed with severe pericardial effusion. And then we tapped the cat, and he had an exudate. The pericardial fluid was full of bacteria and neutrophils. And then on echo, there was this linear or thin and long hyperechoic structure inside of the pericardial sac, which we thought maybe it's just an artifact, but was consistent in different views and was just very thin, long hyperechoic structure. So we drained the cat. So and then on CT, they also document this 7 centimeters long, thin foreign body inside the pericardial sac. And then we send the cat to surgery for pericardiectomy, and they remove a toothpick from the pericardial sac. That's crazy, isn't it? Absolutely crazy.
That's nuts.
Yeah. So it's like traumatic pericarditis in a cow, I guess.
Wow, that's amazing. And these are the things we see and we never publish, right?
And now, it's a shame because the CT images were neat, and I had the toothpick on my desk in Zurich. And when it's when I left, I lost my toothpick.
Sad times.
Which is pretty cool. But imagine a cat to swallow the toothpick, and
and at some point that was going through the cat's esophageal wall, and everyone was thinking, "Why is the cat really cranky today?" Those cats are cranky. Whatever. Let's move on. Wow.
It was very interesting case. So this is a complete outlier. But I thought to share this case with you.
You want an outlier? I've got an outlier for you.
On the 9th day of Christmas, my true love sent to me.
Go ahead.
So this is my second effort to try and convince you that these are the coolest heart diseases. Is parchment right ventricle. Surely everyone out there has seen these cases. They're super common. I don't think they're very common. I have seen one, and this is called Uhl's anomaly, UHL, Uhl's anomaly. This is where the right heart, usually predominantly the ventricle, the myocardium is missing of the free wall of the right ventricle. You just have this thin sheet of fibrous tissue. So of course it's non-contractile. The septum is rarely affected, and the septum is mostly true myocardium. I guess that's because that's the left heart. It's slightly different fibers, and the right heart is so thin that often you can read text through it. So this has been reported very, very, very sparsely in companion animals. I think it's reported in 2 ferrets and maybe 1 cat, or vice versa. I can't remember exactly. But I saw a case in a rabbit with what I thought was arrhythmic cardiomyopathy, because on echo it had a huge right heart, hypokinetic free wall. It was maybe 3-year-old rabbit, I think. It was one of these Netherland giant rabbits. The owner came in for the scan, and of course it was very sad because the rabbit was in right-sided failure. And I was fascinated by this, and I said, we tried to treat, and it wasn't successful. And sadly, the rabbit was put to sleep. And I said, "Oh, would you mind if we took a look at the heart? Because it's not often we get to see rabbit hearts, and I'd be very interested in seeing what's happening here." And then the whole of the right heart, the atrium as well, was just so thin you could just read text through the wall. It was a real parchment appearance. Have you ever seen it?
Do you remember how old was the rabbit?
3 years.
3. Yeah, because as you were saying, on echo they look like an ARVC phenotype, and then we generally, when we see ARVC, well, also very rare cardiomyopathy in cats, but
yes,
when we see them, sometimes we discuss that this could be Hull's anomaly, but then generally I would only consider that in young animals, as this is a congenital defect, an absence of right ventricular muscle. So one would expect them to present in a young age. Is a burst defect, if you want. It's a congenital defect.
It's
of
congenital,
an
isn't it? It's not one that we list on our differentials for murmurs or whatever in puppies. I wonder if it happens and they just don't make it. Most of the diseases that we see are diseases where they're not that bad compared to what happens at birth, and they have to live to 12 weeks or 10 weeks to see a vet to have a murmur detected or whatever. And I think those diseases that are very severe, they cause neonatal death. And these are the, again, in heavy inverted commas, fading puppy syndrome or puppy pneumonia. What is fading puppy syndrome? It's not a real thing. These animals are dying of something. And I suspect congenital heart disease has a very different spectrum if we could look at neonates versus 8, 10, 12-week-old puppies and kittens. In humans, the landscape's very, very different because it's diagnosed in utero in most of the Western countries.
Totally agree. That would be also a research project that one day I would.
It's been on my list for years.
Yeah, I would love to do it, because as you were saying, these complex congenital heart defects are diagnosed in humans, and we certainly miss a lot of them. So there's certainly a lot of very cool stuff on those fading puppies. But that's very cool one. I think I have only seen one cat, which we thought was ARVC, was a young cat, maybe 1 year old. We thought was ARVC. Right. We also got the chance to do a postmortem on the cat, and as you said, the right ventricle was paper thin. Thin. So those are cool. Well, not as cool as a toothpick in the precardial sac, but okay.
Come on. I mean, toothpick pericarditis it's only a thing for you. Uhl's cardiomyopathy. I'll have you know that Uhl's cardiomyopathy, or rather Uhl's syndrome, was diagnosed on a cadaver from the 1880s, and it was first described in the sort of mid 20th century by Uhl and colleagues, but actually it's been around much longer than that, so it's not a new thing. Toothpick pericarditis, I mean, it's a one-off, maybe. It's a one-off.
Yeah, maybe you're right.
On the 8th day of Christmas, my true love sent to me.
So next, I think I would pick chest pain in cats. I think that's something that I think is something very exciting, which we don't really know if it happens or how frequently it happens, but it must happen. It must happen.
It must happen, mustn't it?
People with HCM classically experience angina during exercise, stress associated with systolic anterior motion of the mitral valve is a big thing in humans.
Huge.
It's of course very difficult to know if cats experience chest pain, but then just looking at their cardiac phenotype and histological findings, they must. Considering the amount of replacement fibrosis we see on histology, the case series that we recently described of thin segments that are on histology have like transmural fibrosis, scars, large segments that have
These are
scar
big
tissue.
infarcts, aren't they? These are
Exactly.
cataclysmic events that would have a person hospitalized, and no one's noticed in the cat.
Yeah, exactly.
Well, maybe
even if they happen progressively and are slow, and then ischemia progress is a slow process, still that must hurt. And so I think we are missing cases of angina in HCM cats, most likely in cats with obstructive form of HCM, if you want. We see randomly those, and so I picked this one because I think it's important for vets out there to start asking certain questions to the clients that are presented with heart disease. Because I don't think a client will present to us and say, "Oh, my cat suddenly stops playing or randomly shows open mouth breathing during exercise." But then if we ask
you
that,
occasionally see those referrals, don't you? But not often.
True, you're right, but not often. And then what we feel is like when you ask the client if the cat stops playing and assumes like a crouched position or starts open mouth breathing when they play with the laser with the cat or something like that, those are red flags, and those cats are the ones that we believe might be experiencing chest pain, which is interesting, and it's something that we should definitely address, because these must be horrible, absolutely horrible, the feeling. And this will bring maybe potential a controversial topic, but we would treat cats with HCM and SAM with atenolol to try to see if owners, we generally do a trial of 6 months or so to see if the owners document any increase in activity levels, which one could postulate were previously the cat was experiencing chest pain. So we frequently try atenolol because it's what they try in humans with chest pain. Do you give atenolol in cats with HCM and SAM or no?
Do you know what? This is where our podcast has changed what I do. Because talking to Virginia and talking to you, two people I very much respect and very much value, your experience and your expertise in these cases. I now run troponin if they have outflow tract obstruction above whatever, a gradient of 30 millimeters of mercury. I'll run a troponin. This is what Virginia was telling us. So this is not my idea. If anyone is listening to this and has not listened to our interview with Virginia Lewis Fuentes from season 1, you should absolutely listen to it. It's a great chat with Virginia. All the great stuff is Virginia, not us. We will run troponin, and if the troponin is above the reference interval, we will treat with atenolol for 1 month, and we'll repeat the troponin. And if the troponin has dropped, so far they have all dropped. And we're doing this quite a lot now. My resident Caroline and I, we're continuing the atenolol. Theoretically, our plan for repeating that troponin is if the troponin has not dropped, well, we're not doing anything with the atenolol. So therefore, we won't continue it, because who wants to medicate a cat for 5 years if you don't need to? So we're asking the cat's heart, how sad are you? How high is your troponin? And if it's high, we'll treat. And then we ask, has it helped? And if it hasn't, well, we'll stop it. But so far, all of them, I think Caroline might correct me, all of them that we've done have come down, and we've continued the drug. So that's our approach. Is it evidence-based? No. We have no evidence on which to base that on, but it's logical. And I will confess that 12 months ago, I wasn't treating them.
That's a very sensible approach, and is exactly what we do. And as you were saying, there is no data out there, but well, if troponin is high and then decrease, of course we will need a placebo-controlled trial and so on, because we don't know
that's the difficulty, isn't it?
What happens with troponin over time in cats and so on. But we have the same belief, if you want, that if troponin decreases, hopefully we are helping. They must experience chest pain. It's so difficult to assess pain in cats in general. It's great how much our podcast is changing.
Well, at least what we do.
The approach, what you and me do, which is great.
Yeah, maybe no one else.
Probably not.
But for us,
but still,
we think it's great. So this is the difference between you and I. You've chosen chest pain in cats. It's a big issue. It's a pretty serious issue, actually. And we're thinking about a big welfare topic affecting a lot of cats out there. And I think it's really important you raise that, because it's a real public service. My next one.
I'm worried now.
The next one's random, and it's not a dog or a cat or even a rabbit.
On the 7th day of Christmas, my true love sent to me.
this is a trigger for equine pericarditis. And it's actually caterpillar pericarditis, believe it or not.
What? Really?
It's a thing. This is what happens when you do the American boards. You see, you learn these random large animal topics. So the ingestion of the eastern tent caterpillar, I'll try and say the proper name, Malocosoma americanum. As other people will know it, but you know it now, right?
yeah.
Americanum-itis, it's called. So this has been associated, ingestion of this particular type of caterpillar has been associated with a fibrinous pericarditis in horses. One might say to the horses, just stop eating the caterpillars. But these are a thing. It's a problem in equids in the US. I'm going to show you a picture now of the eastern tent caterpillar. So you can see he's a colorful little guy, yellow stripe.
Yeah.
Down there. What's quite amazing, they're called tent caterpillars because they make a tent to live in and breed in.
Cool.
And you can see the numbers of caterpillars that must be there. So if the horses are just idly, chewing on the food, enjoying themselves, and they ingest a bunch of these caterpillars, they can actually present with this fibrinous pericarditis. And a lot of the time, although we're making light of it, this is bad for the horse. It's not treatable for many cases unless they actually perform surgery to open the pericardium and flush the pericardium. This is very bad. So caterpillar pericarditis, that's literally all I know about it. And that's my third choice.
That's very cool. I've never heard.
I mean,
that's very, very cool.
I think we have a winner right now. Sure. Should we just stop now?
Wait. No. Wait. It's still early days. I'll pick a serious one now.
Okay.
On the 6th day of Christmas, my true love sent to me
AP windows, aortopulmonary windows. It's just that we had in the past year, we saw 3 cases, which will not be the classic window described in the veterinary literature, I would say, which were cases referred as PDAs. They looked like PDAs, like classic PDA morphologies on echo.
Really?
And then when we went and when we were about to occlude them and when we did TOE, they had windows. They had no ampullas at all, or very, very short ampullas. And so very, very short ductus with a large ostium, which would resemble, looking at the Krichenko classification, would resemble his description of type B classification, I believe, where he described windows on an exact position where a PDA should be. The windows I have seen, the windows described in the literature, to my understanding, most of them are in the main pulmonary artery in different locations from where we see PDAs, and these ones were like exactly at the PDA position.
That's super interesting.
And it was very cool. And what I thought was very cool is how useful TOE was, because in fact, so echo was okay. On echo, on transthoracic echo, we could not open the ampulla. We thought that we cannot open it, but maybe it's just a challenging case. And
sometimes it's a bad echo day, right?
Yeah,
you just don't catch it.
And you could not, and that's fine. And then on angio, because the position was classic for a PDA, these were cases with severe aorta and pulmonary artery dilation. It was in fact quite difficult to know exactly where the ductus was. So TOE was paramount. So the first case we saw, our challenge then was how do we occlude? How do we close this defect? We didn't think that surgeons could not do it without bypass. They could not do it because the ductus was very, very short, so you could not ligate.
Surely they wouldn't be able to ligate. It'd be more risk than anything.
Yeah. And then in the first case, we were concerned to use an ACDO because, of course, there is no ampulla, and so the proximal disc is completely exposed, is inside the aorta.
So it's just sitting there in the aorta. I worry about that a little bit.
Yeah, which is cool. So then the first case, we said, okay, no, we will not use an ACDO. We contacted Abbott. They were very, very helpful. And we tried a few ADOs and Platzer duct occluders, but they were all too small. They were all too small because the ostium in the first dog was like 9 millimeters.
Wow.
And so all the ADOs we had available from humans were too small. And then for cost restrictions and so on, we decided, okay, we'll try an ACDO. We oversized the proximal disc a lot in comparison with the ostium. So proximal disc to ostium ratio of like 2.5 times, something like that, because we were also concerned that of the device stability, and that's what they describe in humans, these windows. Then of course the device is not anchored, is not protecting any ampulla. So
and you don't want to lose that in the aorta. I mean, that's a terrifying thought, isn't it?
And so we used an ACDO, large ACDO, and this was a 40 kilos Labrador. And then before releasing the device, we were also concerned that the proximal disc could obstruct the aortic flow, but there was no signs of no gradient on TOE in the aorta, and so we released the device and was fine. And then we had 2 other dogs, exactly the same, very, very similar window-like PDAs, where we have used ACDOs. One in a corgi that we did maybe 4 months ago. I was more worried because, of course, the other ones were medium to large breed dogs, and this one was a corgi, but it was fine. So it was interesting to see that ACDO worked okay. We consider covered stent, as there is this case report from
a German Shepherd of a type 3. Yeah.
Exactly. With the cover stent, that would be another option. Could have been more expensive and so on. So
they're very expensive, those covered stents.
I choose these guys because they looked on transthoracic echo. They was the right location, and they looked very similar to a standard PDA. And then TOE was really helpful. Also to measure, because the thing was the ostium was very oval. That was the other challenge, because the ostium on 2D, in fact, we use 3D TOE, because on 2D, the minor axis of the ostium was much smaller than the major axis. So interesting, they were very, very, very oval, which also made it tricky to pick the right ACDO. To me, the take-home message was TOE really helps, and we now spend a good amount of time carefully looking at the duct when it's not a classic PDA morphology.
Sure, yeah.
Carefully looking at it, because interesting. Did you see cases like this? A window like
it's super interesting. I've seen one AP window, and it was very close to the aortic and pulmonic valves. So it was really on that ascending aorta before the arch, which is one of the classic locations from people. If anyone out there is struggling to visualize this, I think Jose would encourage you as well to look at Busadori's textbook. The recent textbook is beautiful. Have you got a copy yet, Jose? Have you bought one?
No, not yet. Unfortunately, not yet.
No. I bought one at London Vet Show, actually, and I kept trying to buy it at ECVIM and at various congresses. They'd all sold out. So every time I was with Busadori, I wanted him to sign my copy, and they'd all sold out. I couldn't buy one. And he said, I'll send you a signature on a piece of paper. Not quite the same. But in there's a section on AP windows in the sort of left to right shunting defects. And there's a beautiful diagram describing the sort of 3 typical locations. Recently, I've seen 2 PDAs, one Cavalier, one miniature dash hunt, I think, wide-haired dash hunt, who they're very short ampulla. They're like a little sort of wedge. But both these dogs have a bit of volume overload, not massively. They're quite young, and I worry about what will happen in 2, 3, 4 years. Not in the next couple of months. I worry about what will happen long term. So I'm planning on including these, and I'm just I've been thinking, the ampulla is so short. I don't love my transthoracic images. I wonder if these are windows of the same kind as you're describing, because they're very unusual looking PDAs. They're very short. The flow is 5 meters per second. It otherwise looks like a PDA. The location is right. But I think the transesophageal echo on the day of the procedure is going to help us quite a lot with that. And we do that as standard now, the 4D real time to get measurements. Because, my angiograms, I go through phases where my measurements aren't that accurate. And I put a device in and think, I could have done better. The size choices, either oversized, I did one recently, or a couple I had undersized. And I thought, I need to get better about integrating TOE into our surgery day plan for even the standard congenital. So we do that now as standard, just to try and make the most of what we're doing. And by the sounds of it, it's quite important for these, slightly unusual
Totally agree.
cases.
Yeah, totally agree. Looking at the human literature, after we tried M-Plus or duct occluders, they have been using in these Krychenko type B window-like PDAs. They use devices to occlude atrial septal defects.
Oh, really?
So M-Plus or septal occluders, because then they have these 2 flat discs with a very short, very flat, which we are perfect, I guess, because then they will live inside the aorta, and you have a flat disc inside of the aorta. So I wonder in the first case, then we thought we wanted to try, but then we didn't have the funds. but apparently the emplazer septal occluders is what they use in these window-like PDAs.
Right. Those ASD occluders are about £5,000. They're so expensive that often I've done one. Often it becomes cost prohibitive, doesn't it?
Yeah, absolutely. But yeah, so this was my series one.
JC, I think we better stop there for this episode. We've talked quite a lot about these fantastically interesting heart diseases in part 1, and part 2 maybe is a separate episode tomorrow. What do you think?
Sounds great. Absolutely. Let's make a break and then we'll be back tomorrow.
Fantastic. Offer some Christmas cheer and we'll be back tomorrow. Thanks for listening.
Fantastic. See you tomorrow.
On the 12th day of Christmas, my true love sent to me 12 phenocopies, 11 acro hearts, 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows.
Welcome back to part 2 of our special Christmas episode of The Animal Heartbeat, the 12 heart diseases of Christmas. How was your Christmas Eve, Jose? Was it good?
Well, it was great. Thank you. How was yours?
Yeah, fantastic. I mean, Father Christmas came, the reindeer ate the carrots. This year, Father Christmas had a non-alcoholic beer and a rice cake. So it was big news in our house.
Nice. Ready for our second part?
I was born ready, Jose. Are you ready?
Absolutely. Looking forward to see which diseases you pick as part of our 12 heart diseases of Christmas.
I'm going to warn you, there's going to be some obscure ones in the second half.
I'm scared.
That's appropriate. Excellent. Let's get into it.
On the 5th day of Christmas, my true love sent to me.
This is going to be called 5 Kissing Bugs. Excuse my singing. Maybe we should get someone to sing us a version of this that's better. So 5 Kissing Bugs. So this is myocarditis caused by Trypanosoma cruzi. Trypanosoma cruzi, thankfully, because of temperature, lack of reservoir, etc., is not in Northern Europe. So it's not something we see, but it's very common in the southern USA, especially Texas, Mississippi Delta, Central America, South America. There's a lot of cases of this in dogs and in humans. So if you look at the work from Texas A&M, especially Ashley Saunders, they've published a lot of work looking at trypanosoma myocarditis or Chagas disease in dogs as a model of the human disease. And there are different phases. There's acute infection, there's chronic infection, and then there's the sort of residual scarring that's left. This would be under our number 12 disease, our day 12 disease, that the DCM phenocopies. So, you may have a dog presenting in the chronic phase of Chagas disease, where actually they look like DCM. They don't look as if they've got an infectious disease at all. And the only way you can find out what the trigger has been is to run titers to look for Trypanosoma cruzi exposure. So the parasite itself is transmitted by these kissing bugs, these Reduvidae species, and they're horrible little critters. If you Google them, they look a bit like shield bugs, but with a very long nose and very long legs. And they actually pick up the parasite from host species, and it lives in their gut. And one of the habits of these kissing bugs, which is particularly disgusting, is they bite the dog, or in fact the person, and then they sort of defecate and smear it around, and the parasite has been in their gut and comes out in their feces and goes in through the bite. So it's not in the salivary glands, it's actually in the hind gut, and it passes into the body. So this is a common cause of active inflammatory myocarditis in these cases in the US and Central America, and it's a horrible condition. There's actually not a great treatment for it, even in 2023, 2024. We're not looking at a disease where you can treat the parasite effectively. A lot of the drugs that are used in humans are very reserved for humans and really shouldn't be used in dogs. So it's a real challenge. It's a real challenge. And sometimes you don't even know the dog has been exposed. So you don't find it in the acute phase. You find it after the damage is already done. So even if you could treat, sometimes we're just dealing with the phenocopy of DCM in the end. So it's a highly challenging disease, very, very important in certain geographic areas for humans and dogs. And of course, dogs can potentially act as a reservoir for people. So, there are some real challenges in these cases as well.
It's a very serious and sad disease, but very cool, I have to say.
It's super interesting.
Yeah, super interesting, yeah.
And, I think in Europe, people talk about Neospora and Toxo, and we say, they can cause myocarditis. Have you ever seen a convincing case report or a convincing case in clinic of Toxo or Neospora protozoal myocarditis in a dog?
No. As you're saying, we always measure it and then look for them, but no, not really. No. Yeah, we don't have cool bugs around here, except for Angiostrongus vasorum.
Wow. We all know that's a cool bug, right?
We did that's not in our list.
It's not in our list, but I think it's just so cool. Yeah. We just take it as read,
Yeah, exactly.
It's right up there.
Cool. So I guess it's my turn. I'm sorry if this is not a huge surprise.
On the 4th day of Christmas, my true love sent to me.
So I picked transient myocardial thickening as one of my favorite diseases, and
I am supportive of that choice. I mean, it's an important condition.
And but I did that because there's been this recent case series published from an Italian group, Giovanni Romito, the first author from Bologna, and they describe 27 cases of TMT in Italy. And why I think this is cool? Because our initial case series was 21 cases of TMT, and we recruited cases.
You reckon they recruited those last 7? They were like, we're going to beat those guys, those
Yeah, no, I'm
guys.
sure.
They can't have the biggest number.
Exactly. And I say, yeah, we have the biggest case series. But the cool thing is we didn't have any we had cases from Switzerland and the UK.
Right.
And so what I think is very neat is what they describe is exactly what we have observed in the UK and Italy.
Absolutely.
So exactly the same disease. So which is very interesting to have a second independent case series in a different country that describes very, very similar features. So again, these were young animals, like 70% of the cases were less than 5 years old. They had antecedent event, increased troponin I, decreased LA fractional shortening at admission, which then improved over time with reverse remodeling. And so very, very similar characteristics to what we have described in cats a few years ago. And again, the problem with TMT, and that's why I thought it would be interesting again, that's why I nominated as one of the cool diseases, is we don't know what is causing it.
Yeah.
The Italian case series, they strong believe that could be myocarditis, and in like 26% of their cases, they identified an agent that could be causing myocarditis. They had serology for Bertonella and Toxo.
They're all Bartonella positive. I mean,
true.
My thoughts on Bartonella, unless you've got it on fish, on fluorescent in situ hybridization on tissue. I just don't buy it. I just don't buy it.
Yeah, especially because we also had a serology positive in our cases, cases that we did not treat, and they still reverse remodel. But even if 1/3 potential or some cases are infectious, then we still have the other 2/3 where, or either they are infectious, like viral myocarditis, as in humans that we don't know because we don't know any cardiotropic viruses in cats, or we don't test for them.
Well, okay, listen, we're going to come back to that. We're going to come back to that in a minute. Okay.
Yeah, exactly. And or again, we don't know the etiology, or they are stress induced. They look like Takotsubo, like cardiomyopathy in humans. So I thought
so that's interesting, isn't it?
Yeah.
For me, I think TMT is a syndrome, not a disease. I strongly suspect there's a couple of different things associated with it. People say to me, "Oh, don't you think it's myocarditis? You think it's stress, not myocarditis." Well, myocarditis means inflammation of the myocardium, right? It doesn't mean infection.
Yeah.
It doesn't have to be an infection. Maybe it's viral, sure. Maybe it is Bartonella. Maybe I've got no idea what I'm talking about on that front. But who's to say that catecholamine excess couldn't cause inflammatory changes to the myocardium, much like Takotsubo cardiomyopathy
and edema and myocardial edema.
Right.
Absolutely. And again, also in their case series, some cats reverse remodel quite quickly. So this needs to be fluid shifts. And so, no, I agree. I totally agree with you. I think this should be considered a syndrome with different triggers. And then we have the nice case series from, or the manuscript from Joshua Stern on California, in cats that survived the California wildfires, that also some cases had TMT. So very stressful environment. And so certainly a lot of stress triggers and inflammatory markers and so on going on. So it's interesting. So I think indeed different triggers may potentially cause this transient myocardial thickening. But yeah, I just honestly loved it that the different case series, even though they were a bit chicken, they wanted to clearly they wanted to beat us by 6 cases.
Guys, we've got to wait to get another couple of cases before we publish it.
But still, Ramito, congrats. It's
absolutely.
nice
Props.
that you really showed exactly what we have described before.
Do you know that this we're joking about, oh well, they just publishing to get more cases than we have, sort of thing. But actually there's a lack of repetition in the veterinary literature. You have one study shows one thing and then everyone goes, oh yeah, great, that's it, that's a fact. But then you repeat it, maybe someone repeats it, and the findings just don't add up. They just don't do the same thing because it's a different population. The protocol is slightly different. Maybe it was just random chance first time, that the P less than 0.05. Well, it's a 1 in 20 chance that it's going to come up positive. So, I'm very pro publishing more case series on a particular thing. You describe it once, that's not enough. That's not, with this disease, it's not enough. We need more to understand what's going on. And, our data was published in that 2018 case series, was published on cats from the UK and Switzerland. Who's to say it wasn't Angiostrongylus causing it? I mean, who's to say it's not something that the rest of the world see? This data is published from a different geographic location. It supports that this is a feline condition, not a UK condition. And that's really important, I think. That's really important, especially when we don't know what the hell's going on.
Absolutely. I totally agree with you about that. I think we have a lot this feeling that, okay, this has been published. We will not invest the time to publish again. But especially, we are not talking about our manuscript. They're not talking about 500 cases, 1,000 cases, 2,000 cases. So we publish like...
It wasn't
10,
in
20,
Nature,
30. Exactly. And so why not publish it again and see if you get the same? I totally agree.
Absolutely.
Yeah, cool. So TMT, what next?
TMT, an unknown transient myocardial disease. Well, you know what? I've got 2. I'm going to give you 2 now that are are transient myocardial conditions. Now, the first one, I'm going to be honest. This is a human condition.
On the 3rd day of Christmas, my true love sent to me 3 childhood fevers.
This is not something that is published in veterinary species, but why not? Why are we not seeing it? Is there something different? This is a disease called Kawasaki disease. Has nothing to do with motorcycles. This is a condition which was described by Kawasaki is a transient inflammatory myocardial disease in children. It's also known as mucocutaneous lymph node syndrome. So it's not just the heart that's affected. This is a systemic disorder, and it's well described in humans. And it was described by Kawasaki, decades ago. We still don't know what causes it. There's various hypotheses that it's like a vasculitis of the coronary arteries triggered by some sort of infectious agent, but they can't get to the bottom of what's causing it. And often it's associated with lymphadenomegaly, and typically, the child has a fever, lasts 3 days, 5 days. They may develop arrhythmias. They develop lymphadenomegaly, and that's a big high index of suspicion for evaluating for Kawasaki disease. So this is a syndrome, and it's thought to be associated in, some people have said it might be associated with scarlet fever or rheumatoid syndromes, but nobody knows. Is there something like it in animals? Is there space out there for us to be seeing transient changes in systolic function or myocardial dimensions in puppies, kittens, juvenile animals, 1-2-year-old animals that just self-resolve? And I think if I saw it in a cat, I'd call it TMT, and I'd say, well, there was no recent stressful event. Yeah, whatever. There must have been. The cat just didn't tell us they were stressed. And in dogs, maybe we'd say, oh, maybe it was a septic focus causing systolic dysfunction, that sort of SIRS type inflammatory change that affects the myocardium. So we see inflammation, systemic inflammation causing systolic dysfunction in dogs and cats for sure, especially dogs. And we don't understand what's happening. The treatment for this in people is they often treat with aspirin, and they treat with immunoglobulin to try and deal with whatever inflammation is going on, whatever microvascular disease is going on. Most people recover, most children recover. Some of them are left with aneurysmal changes to the coronary arteries. So definitely there is inflammation within the wall of the coronary arteries, but many of these coronary aneurysms resolve. The death rate's less than 1%, but the presenting signs can be quite dramatic. I think that's really interesting. So I guess two things that makes me think about, are we seeing it, or whatever it is, this Kawasaki disease, we'll maybe call it Borgea disease if we see it in juvenile dogs and cats. Would we even know it was there? Because we already have other things that we think explain the changes we're seeing. So maybe we're completely ignorant of this, and we're just saying, oh, it's sepsis or whatever. And the second thing is, I've got small children. I worry about about things like this. Next time my kid has a fever, I'll be like, oh, I'll just check your lymph nodes. I'll just maybe we should just be ordering some immunoglobulin,
Yeah. No, those conditions are very interesting indeed. Like how inflammation can affect the heart.
Right.
It's, as you were saying, the SIRS guys we see in dogs, as the RVC published, those guys with mild pericardial effusion, and we see them, trace pericardial effusion, systolic dysfunction, which is transient. That's very interesting. I always wonder, are there any sequelae? Are there, as you were describing those coronary aneurysms and so on, these guys we see with SIRS, and then the heart improves and so on, but are there any sequelae? It would be interesting to follow also these guys over time. But yeah, inflammation in the heart, it's very, very cool. Well, not to talk about the potential effect of inflammation on HCM and other cardiomyopathies, but that's
inflammatory cells are there, right? I mean, it's part of the histopathological features of a lot of cardiomyopathies. So are they chicken or egg? Are they causative in some way? Do they potentiate the disease in any way? This inflammation, this inflammatory infiltrate, or is it a result of necrosis? It's sometimes hard to know, because we often get the histopath at the end of the day, and we don't know what happens over time.
On the second day of Christmas, my true love sent to me.
Leading on from these children with an unexplained fever and lymphadenomegaly, Kawasaki disease, or rather a Kawasaki-like disease, was seen an increasing number in children around the time of the pandemic, of the COVID-19 pandemic. And it's been linked to COVID in children can cause a particular myocardial inflammatory syndrome. And in adults, COVID can cause a frank myocarditis. So can COVID be a problem in our patients? This leads me on to my final top heart disease of 2023, is SARS-CoV-2 induced myocarditis in dogs and cats. It's a controversial area, and the publications out there are sparse and a little bit controversial. Some of the testing's not been brilliant or well validated, and sometimes myocarditis is defined just as an increase in troponin. Now, I think you and I both know that that's not how we would define myocarditis. For me, defining myocarditis would be looking for systolic dysfunction, pericardial effusion, arrhythmias, and an increase in troponin. So it's not just the troponin. So for me, in dogs, certainly I expect that kind of constellation. Maybe they're not all present, but I'd expect more than just the troponin increase. A couple of years back, I saw a dog who had a systemic disease which progressed to myocarditis, and we were all still masked. We were all still socially distancing in work. And I thought, I wonder if this could be SARS-CoV-2 myocarditis. And we did a nasopharyngeal swab, and it was positive for COVID. And the owners had noticed the dog develop initial signs, gastrointestinal signs, when they were on the 3-week lockdown. This is back in 2020. And the dog sadly died, didn't make it. We sent his remains for necropsy with the government agency, and they found COVID all over this dog's body. It was all over the place, in the brain, in the respiratory tract. It was in the heart.
Wow, really? Interesting.
Yeah, it's Delta variant. So, you know, dogs are not very commonly affected by coronaviridae. They're not very susceptible compared to cats. But I think when dogs do get them, they can be pretty bad. And I saw another dog who survived, who did have a positive nasopharyngeal swab as well, with myocarditis, based on my more stringent criteria. So I think it does happen. It's not very common. I think it does happen. In cats, looking at the data out there on COVID and cats, it is reported that cats had high antibody levels in an Italian population back in the lockdowns. IDEX Labs ran a bunch of antibody tests on cats, and they found a number of cats had exposure to COVID, but none of them had blood taken for signs of COVID. They were all having bloods for like pre-anesthetic work or routine blood monitoring or kidneys or whatever. So it seems to be a lot of cats had some sort of immunologic exposure to COVID, but no signs. And that's always what I thought. And then I saw a case report recently where Valérie Chetboul and her colleagues in France have published 2 cases of a myocarditis, high troponin, echo changes, and lingual ulceration. So big tongue ulcers in these cats, in 2 cats that were positive for COVID. And they were treated, and the clinical signs resolved and the cardiac changes resolved. So that's interesting, because maybe it's out there and we're not detecting it. Maybe we're thinking it is TMT. Maybe we're thinking it is HCM and we're not looking. In the last 5 weeks or 6 weeks, now I'm going to preface this by saying maybe I don't know what I'm talking about. Maybe I'm seeing shadows and I'm not really seeing something that's a genuine disorder here. But I have seen 5 cases in 6 weeks of cats who presented with acute respiratory signs that really sounded like heart failure, really looked like heart failure on a radiograph, one of them. And on echo, all had myocardial thickening and left atrial dilation. Looked a bit like TMT, quite symmetrical thickening, left atrium not that big. And these cats had troponins that were through the roof. 2 or 3 of the cases, their atrium wasn't that big. And I wondered, well, they had some diuretics. Maybe it was, you know, maybe the atrium had been shrunk by the diuretic therapy at the primary vets. One of the cats had a troponin of 35. One had a troponin of 152. I mean, crazy high, not questionable, much higher than I would expect to see in HCM. All of these cats had reversal of the cardiac hypertrophy and left atrial dilation and normalization of troponin in 1 week. Now, that is very fast for TMT. A couple of them had stressful events. My cat has a stressful event every day, so I don't know how reliable that history is. But I wonder if there's something else happening in these cats. I don't know. And I wonder if it's some sort of viral condition. Could it be COVID? I don't know. I'm not suggesting that it definitely is. But I think that coronavirus-induced cardiomyopathy is out there, or myocarditis is out there in the population of cats. There are published cases of it. I think it's there in dogs too. Is it very common? No, I don't think it's very common. Is it something that we can catch? No, I don't think it's something that we can catch. I don't think it's a public health issue, but I just think it's an interesting one. And I wonder if we'll come to understand things a bit better over the coming years as we're less afraid of COVID and we are investigating it a bit more. What do you think? Do you think I'm crazy?
No. Well, I think that would fit the TMT description and diagnosis. We had some cats in the case series, as the Italian group had, that reverse remodeled after a week or 2.
Yeah, it's really fast.
And so it's very fast. I think that indeed would suggest myocardial edema. So I think would tick all the boxes for myocarditis. But as you were saying before, what is the bug? What is the trigger? And then you can, in humans, myocarditis can be caused by a hypersensitivity reaction to medications, for example, and stuff like that. And so there are so many different triggers of myocardial inflammation. That's why I like what you said before, that TMT should be seen as a syndrome with different triggers, and TMT just describes what we observe on echo. We just need to get better at screening for different infectious causes in cats. Viral myocarditis in humans is the most common cause of acute myocarditis. Right. We just a bit similar to what Santilli did with dogs, and looking for cardiotropic viruses and so on. We should try to do the same in cats. Because it makes sense that coronavirus or others could cause HCM in cats. How old were your cats? The 5 we have seen?
Range of ages. None of them were very old. I think the youngest was 1 or 2, and the oldest is maybe 9. A breadth of ages, both genders.
And what I think this is important really is the take-home message for vets, that many cats are presented with very thick ventricles and in congestive heart failure, which may be perceived as a situation of very poor prognosis and a lot of potential investment for the clients and so on. But some of these cases will reverse remodel, and we have an excellent prognosis. So I think really what we should say again is that it's totally worth it to invest in these cases, to try to treat these cats, because you never know that maybe after a few weeks they are rare, but the ones that reverse remodel are very rewarding, and these are cats that are back to normal. So it would have been a huge shame to just pull the plug and quit on them.
I think my top tip is measure troponin, because it might change how you think about the case if it's very high.
Agreed.
So but by my calculations, my rudimentary mathematics, we've done 11. Jose, you have the honor of giving us a partridge in a pear tree, maybe?
On the first day of Christmas, my true love sent to me a thrombus in a vascular tree.
And the thrombus in a vascular tree. So I think I would pick AT and thrombus.
Oh, nice.
So there's been a clinical trial called the SuperCat that the results were presented at ACVM this year. I don't think that the manuscript is yet published, but it's again an attempt to see what's the best treatment in cats with AT. And these clinical trials are very, very challenging, because it's very, very challenging to recruit cases. Many cases will be lost to follow up. So again, congratulations to the authors that have worked on this case, on this clinical trial, and hopefully we'll see it published soon. So my understanding, so they compare SuperCat, they compare rivaroxaban to clopidogrel for prevention of secondary thromboembolic disease. So these were cats that had an ATE and then were started in either rivaroxaban or clopidogrel. And it seems that rivaroxaban and clopidogrel were similar, were equivalent. They had similar outcomes in these cats. We know from the past that the fat cat study showed that clopidogrel is superior to aspirin, and now the SuperCat study seemed to have shown that rivaroxaban is equivalent to clopidogrel. What we don't know, but we'll wait for the result, the paper to be published and so on. What we don't know is if we combine these drugs, combine therapy, dual therapy, clopidogrel plus a factor 10A inhibitor, so in this case, rivaroxaban, is that better just to give one or the other? We don't know that yet. That's an important question, because many of us now combine these drugs when we are very worried about the risk of the thromboembolic disease. There's only one case series, I believe, from Joshua Stern, a retrospective study that looked at cases where they have combined therapy, and only a small number of cats had adverse events. So this seems to be safe, like 5 out of 32 or something like that. So I picked thrombus because it's so common in cats. Is a dreadful sequela, complication of cardiomyopathies in cats. We have now this new trial, the SuperCat study, which has shown that rivaroxaban is equivalent to clopidogrel. The question is still there. Is it better to combine these two drugs? What's your approach? When do you use clopidogrel, rivaroxaban, or you combine them?
Well, I came across a nice paper actually from the Stern lab, Ron Lee, Josh Stern, and their colleagues, which was looking at in vitro platelet function in cats. And it seemed like clopidogrel and rivaroxaban had a synergistic effect in vitro. Now, that's very different to clinical outcome-based studies, as you know. I think we're working up to a trial there, I suspect. Josh and Ron have done a lot of work on feline platelets. So they're looking for, is it safe? Looks like it's probably safe based on retrospective data. Is it something that has a good theoretical benefit? Yeah, it has. That's what the in vitro study shows. There's a theoretical benefit. So I think the next step there is logically a clinical trial. So hopefully that this is something that there'll be some investigations coming over the next few years. As you say, it's challenging to recruit cases. Trials in cats with cardiomyopathy, especially cats with ATE, are really difficult. My approach, I start them on clopidogrel. I start them when I would classify them as B2, So that's based on left atrial fractional shortening and left atrial size, but mostly left atrial function. If their function is low, then I would classify them as B2. Often their left atrium is large as well. I start them on clopidogrel, 18.75 mg per cat per day, and I see how they get on. And normally I'll pull them back for an echo in 3 months. I don't like seeing them too often. But one thing I would like to know is, are we doing enough to inhibit the platelets? Now, I don't think there's a good blood test at the moment to say that we are doing enough to inhibit platelets or not. But I look at the echo to see, is there a thrombus forming? Is there dense smoke? So I had one recently where there was dense smoke. And I spoke to the owner and I said, well, I don't know that dense smoke is increasing your cat's risk of ATE, but I am worried by that. And the cat was on clopidogrel at the right dose, was getting the dose every day. So I talked to the owner and we said, well, let's switch to rivaroxaban and just try rivaroxaban, see if it does something differently. The cat came back last week. It's no different. It's just the same, very dense, spontaneous echo contrast, almost like a wannabe thrombus in the auricle. So now the cat's on both. My aim was to try and minimize the number of drugs the cat was receiving to maximize compliance. That's generally my approach. So I don't often see cases where I would say you need clopidogrel and rivaroxaban, because I don't know that the combination is better. Have I used them together? Yeah, sure, absolutely. I have used them together, and I would do so again.
We tend, so even though we don't have data to support that and so on, we tend to based on what we know from humans, we tend to combine them when we are very worried, we are very concerned. So case with thrombi or thrombus or very, very thick smoke, as you were saying, we tend now to combine both drugs that hopefully will have a more holistic approach and hopefully a stronger effect on coagulation. So we do that. So in case that we are very worried, we combine them. What we have also been doing sometimes is to use clopidogrel as a first-line treatment when the cat does not tolerate, using rivaroxaban as a first-line treatment when cats do not tolerate clopidogrel, because clopidogrel is very bitter and so on.
Right.
And rivaroxaban is anecdotically easier to peel, or is not as bitter. Having said that, it's way more expensive than clopidogrel. So we balance that, the cost and the ability of the client to give clopidogrel, because I guess that's the other advantage of rivaroxaban is hopefully it's less bitter to cats and they tolerate it a bit better. But overall, honestly, I like that we have different options, because what is always frustrating is when you don't have any option. And you may say, yeah, we don't know if one is better than the other, or if combining is better, but at least we have options.
It's a luxury to have choice and drugs that are safe and at least have some evidence behind the use of clopidogrel. You know, that's great. We've got evidence-based medicine saying that clopidogrel is our first line. That is a luxury, especially in cats. So we've done the 12 heart diseases of Christmas. We've talked about dogs. We've talked about phenocopies. We've talked about infectious disease. We've talked about invertebrates, and we've talked about feline cardiomyopathy. What's your vote for number one, apart from the caterpillar pericarditis, which I think is a given?
I will pick one that we did not discuss on this 12.
Oh, you can't do that.
Can I?
The 13th day of Christmas.
I was just thinking about it. And honestly, I think something that you're going to like this. Something that I think became a bit of a game changer and will hopefully even be a bigger game changer in the future is the use of transpulmonary stents to treat pulmonary stenosis. And no, I'm not pulling your leg. I think this is, and
You're
congrats
joking.
again that you published that, because you see, this is something that many people, most cardiologists now are doing, and we had nothing. We didn't have any good option for very dysplastic type B, whatever you want to call them, pulmonary valves, especially like brachycephalic dogs, which we see nowadays. We see all the time brachycephalic dogs are all over the place, the bulldogs, and so the Frenchies and so on. And honestly, I think we need to wait to have long-term follow-up and so on.
Yeah,
but it's very cool. Is a procedure that has become available, or more and more people are doing in the last year, I think. And so that would be my first pick, pulmonary stents. And congrats for your case series. And I think, and not talking about anomalous coronary arteries, because they also may be a game changer for anomalous coronary arteries. So it's a cool intervention. And yeah, there you go. Sorry that I didn't pick the caterpillar pericarditis.
Well, I mean, I'm still voting for the caterpillars, and I think that's an illegal move. Although I really appreciate your positive response to the transpulmonary stents. For those of you who don't know, I've done a lot of work on transpulmonary stents and I'm trying to refine the technique and train other people to do it. So goodness knows we'll probably find they're terrible. Hopefully not. But we don't know the long-term outcome yet. Although my experience of them, having been doing them since 2017, is it's generally pretty positive. So I'm still comfortable that I think it's the right thing to do for lots of those dogs. We cannot possibly have something that I've published as the winner of the 12 days of Christmas. So let's have that as the 13th day. Lucky for some. I'm going to vote. I mean, I can't vote for caterpillars really. I think I almost want to go for something reversible, something with a nice, well-defined treatment, and something that's not very common. So obviously, toothpick pericarditis is getting my vote for number one. JC, where are you at? What do you think?
Well done. Honestly, I think I go for the caterpillar because it was something I have never heard before, and I think it's very nasty, but I learned something today, so it was cool.
You know why I brought it up, why I mention it, and why I love it as a thing. It's an exam question I got wrong. So
it was an exam question. Yeah, well, yeah,
it's an exam question I got wrong. Who you know, sometimes these small trivia things count for a lot in the MCQs, don't they?
Yeah. So that's it. Caterpillars and toothpick.
Caterpillars and toothpicks are the prime pericardial diseases, or in fact heart diseases of 2023.
Of the year. Wow.
What a duo. What a duo. I don't think any of the listeners saw that coming. Great. So I think that's it. I think 2023 is nearly done, isn't it? It's the festive season, but let's let's think about next year. Let's head into next year. Any plans, Jose, for 2024?
Yes, we can already share that we'll have a very cool and interesting podcast, a live podcast. We'll be part of the Podcast Cambridge Festival, and we will have a live podcast from the St. John's College. We have some great guests where we'll be discussing heart surgery in dogs and humans with some great guests, human and vet cardiac surgeons. So watch this space. We will tell you more very, very soon. But our season 2 opener will be a live podcast. We are very excited about it.
Super excited. And what's going to be very strange about that, not only will we be in the same place doing a podcast, which has only happened once before, but we will be hosting that in front of a live audience of 150 guests. So if you would like to attend and join us, we'd love to meet some of the listeners face to face and catch up with you guys and share some of our joy in veterinary cardiology and human cardiology too. So please look out on the social medias and web services for news about how to get tickets.
We should say already that the tickets will be free. So it'll be free tickets. So
no one's going to pay to see us. I mean, let's be honest.
True, that would be crazy, right? Maybe the students, but yeah, maybe students. Because they want to pass the exams. So brilliant. Hey, Kieran, it was a pleasure. Very, very cool to record this season 1 with you.
It was a pleasure.
Looking forward for 2024, and happy Christmas to everyone.
Happy Christmas. I'm off to baste a turkey and have some pudding, maybe.
Nice. Hey, all the best. Have a great 2024.
Thanks, everybody. Thanks for listening.
See you later. Bye-bye.
On the first day of Christmas, my true love sent to me a thrombus in a vascular tree. On the second day of Christmas, my true love sent to me 2 COVID cases and a thrombus in a vascular tree. On the third day of Christmas, my true love sent to me 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the fourth day of Christmas, my true love sent to me 4 TMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the 5th day of Christmas, my true love sent to me 5 kissing bugs, 4 TMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the 6th day of Christmas, my true love sent to me 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 7th day of Christmas, my true love sent to me 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 8th day of Christmas, my true love sent to me 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 9th day of Christmas, my true love sent to me 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 10th day of Christmas, my true love sent to me 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 11th day of Christmas, my true love sent to me 11 acro hearts, 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 12th day of Christmas, my true love sent to me 12 phenocopies, 11 acro hearts, 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree.